You ever feel like your body and your mind are both against you? Like you're dealing with physical pain, but at the same time, your mood is just down? Turns out there's a strong connection between nerve pain, or what we call neuropathic pain, and mental health. There's a treatment that can target both of them at the same time. I'm Dr. David Danish, a double board certified psychiatrist specializing in treatment-resistant conditions. And today, we're talking about how certain antidepressants, specifically SNRIs, are actually some of the best medications for chronic nerve pain. Let's start with a quick question. Have you or someone you know ever dealt with burning, tingling, stabbing pain in your hands, in your feet, in other parts of your body? Maybe from diabetes, an old injury, previous chemotherapy? That's neuropathy, a type of nerve pain that can be absolutely debilitating for some. And if you've experienced it, you know it's not just physical. It can take a huge toll on your mental health. Here's where it gets interesting. There's a class of medications called SNRIs, and that stands for serotonin norepinephrine reuptake inhibitors. They were originally designed as antidepressants, but over time, researchers realized that they also reduce nerve pain. How? Well, these medications, such as Duloxetine, also known as Cymbalta, Venlafaxine, also known as Effexor, increase the levels of two key neurotransmitters, serotonin and norepinephrine. And norepinephrine in particular plays a very big role in pain perception. Think of it like this. Your body has built-in pain gatekeepers that help control how much pain you actually feel. SNRIs basically turn up the volume on these gatekeepers, making it harder for pain signals to reach your brain. So the same medication that lifts your mood or lowers your anxiety can also physically dial down your pain. Duloxetine, for example, is actually FDA-approved for treating nerve pain in diabetic neuropathy and in fibromyalgia. Studies show that around 50% of people who take it experience a significant pain relief, compared to less than 30% of patients in those studies who are taking a sugar pill. That is a huge difference in our field. And in many cases, people start noticing improvement within just a couple of weeks, with full benefits kicking in around the 1-month mark. Here's the bonus. It's not just pain relief. Since SNRIs are antidepressants, they also help with depression and anxiety, which are incredibly common in people with chronic pain. In fact, one study found that 66% of people with neuropathy also had depression. So when you treat the pain and improve the mood at the same time, you're breaking that vicious cycle where pain makes you depressed, and then that depression feeds back and makes the pain even worse. Now, like any medication, SNRIs are not for everyone, and they come with their own side effects. Some people experience mild side effects like nausea, dizziness, dry mouth, other versions of stomach upset, usually in the first week or two, but for most of these people, those fade very quickly. There are also some considerations if you have high blood pressure or liver issues, so this is definitely something to talk with your medical practitioner about. If you struggled with nerve pain and your mental health, an SNRI could be a game changer. And if you're wondering whether it's right for you, I've put together a free handout breaking down who benefits the most from SNRIs and what to watch for when starting one. You can grab it at drdaviddanish.com after signing up. If you found this helpful, don't forget to like, subscribe, and share it with anyone else you think might benefit. It'll help get the word out for me, and hopefully it'll help them make better and more educated decisions.